Kidney transplant, it is a life transforming surgery. It already in adults is a technically and medically complex procedure which requires preparing the donor and recipient well as surgical precision is needed to execute the task without any scope of error. This kid, who is 11 years old, came to us from Ethiopia with kidney failure.
My name is Jait Makwanant. I'm come to Ethiopia. I'm 14 years old. I have kidney problem. I'm come to India and Sanar Hospital and contact a doctor and he's transplant my mother.
And the challenge in his case was to make sure that after kidney transplant, the primary problem that caused his kidney to fail, it does not affect the transplanted kidney.
And we did some genetic tests also, and we did some tests so that we rule out any possible recurrence of kidney issue after transplant. And then we went ahead and did the transplant in August.
Children, pediatric age group transplant is a technically complex procedure because the body of the child is much smaller and we have to take very fine stitches and the precision has to be very high to execute this task to perfection.
ከዶክተሮች ጋር ኮንታክት በማድረግ ከእናቴ የእናቴን ኩላሊት ወደ እኔ ትራንስፕላንት አድርገውልኛል። ከትራንስፕላንት ካደረጉ ወዲያ በጣም ጥሩ ነገር ያለሁት። ድሮም ብዙ ምግብ አልበላም ነበር፣ አሁን በጣም ደህና ነኝ እና ዶክተሮቹን አመሰግናለሁ።
Fortunately, this child who received the kidney from his mother, the surgery not only went perfectly, the post-operative course and acceptance of the body for this new kidney was amazing. Now, this child is fit to go back to his country with a creatinine of 0.7.
And since then, he has had a good growth spurt. He has, I think, achieved some inches to his height, and he's doing well. And I'm happy to have him as a patient.
And he's good. I'm here as good. Feels good. And thank you very much.
So such gratifying results, they encourage us to increase our expertise more and more in this particular subspecialty of urology, because this does not just improve the longevity of the patient, this gives more quality to life and add many years to the life. Thank you.